Hi everyone, welcome to today's episode, 21 Questions with a Family Physician. Today we have the pleasure of being joined by Dr. Jasleen Sadyora. Hey Dr. Sadyora, how are you today?
I'm doing good. How are you?
I'm great. Thank you so much for being here. I really appreciate you coming through.
Yeah, thanks for having me.
So can you share a little bit about yourself?
Sure. I'm a family doctor practicing in Toronto, Ontario. I work in mostly outpatient practice.
All right, perfect. So now we'll be going to 21 questions, and they're all about med.
All right, let's do it.
So, number one, when did you know that you wanted to be a doctor?
Pretty early on, it was something that was really encouraged by my family since I was young. But growing up, going through school, I realized that I was, better at courses like biology, and I was really interested in learning about the human body and the different disease processes. So that was something that I gravitated to.
Awesome. What specialty did you want to pursue at the start of medical school?
So since I didn't have too much exposure to medicine, I'm the first doctor in my family. So the only real medicine that I knew was family medicine. So I thought that that's the kind of doctor that I would want to be, or a pediatrician, since I also like kids.
So exactly how and when did you figure out what type of doctor you wanted to be?
So this happened during medical school, during my clinical rotations, where I was able to rotate through different specialties and see how, different specialties worked. I enjoyed family medicine because, I'm really passionate about preventative medicine. And with family medicine, you can step in, before a problem takes place and to see, what risk factors someone has that may lead them to having a certain disease to stop them from developing the disease in the first place. I also really liked that, I can work with patients as young as newborns to geriatrics, and also form, that continuity of care and get to know my patients really well.
Okay. What education did you complete before going to medical school?
So before medical school, I did my undergraduate degree in kinesiology at York University.
Okay, cool. Where did you go to medical school?
For medical school, I went to St. George's University in Grenada.
All right. Where did you train for residency?
For residency, I did my family medicine residency at the Brooklyn Hospital Center in Brooklyn, New York.
What's the best advice you received in medical school?
In medical school, I think the best advice I received was just to keep an open mind through clinical rotations. So that when applying for residency, I would try to pursue something that I was genuinely passionate about and liked.
Okay. Now, what's the best advice you received in training?
I think the best advice I received in my residency training was by one of my mentors when I was graduating. She told me that, whatever you do, make sure that you protect your license because you work so hard to get it. So, to do things by the book, and to always try to do the right thing for your patients.
Okay, now can you tell us a little bit about your most memorable case during medical school or residency?
So I think my most memorable case comes from my clinical rotations when I was rotating through surgery. I was on call with a general surgeon, and it was 2 a.m. and a patient came through the ER with severe abdominal pain. He was about 80 years old, and his x-ray showed that there was free air under the abdomen. We were suspecting malignancy, probably in the colon, since he was 80 years old. He had never had a colonoscopy. We took him for emergent surgery. It turns out he did have cancer, but it was in his stomach, which caused the perforation. And I got to assist the surgeon in removing the cancer and then patching him up. It was just a really cool experience because I was able to see a patient from start to finish, since the patient came into the ER to assess them, to see them through surgery, and then follow them post-op. It was just a really cool experience, and even though obviously didn't end up pursuing surgery, it wasn't for me, that case just always sticks with me because it was really cool.
Well, that's pretty awesome, especially to be able to do that as a student. Wow.
For sure.
Looking back, what was the most challenging part of your journey to becoming a physician?
I think the most challenging part was definitely my residency, just because, in each class we had 7 people, and we do manage, family medicine at the Brooklyn Hospital Center, we do manage a lot of patients, whether it be on the inpatient and outpatient setting. Sometimes I was on call for 24 hours every other day, and that was really taxing. I think another thing that was really challenging was dealing with COVID, because I was doing my residency when
Wow.
The COVID pandemic started, and this was in New York
New
City.
York.
Yeah, so dealing with all of the uncertainty, we didn't know, at that time what the virus was, how to treat it. We didn't have enough PPE at the hospital. At one point we were wearing garbage bags and wiping those down and reusing them. It was really difficult time, and also really challenging to see so much death, and there's so much that we couldn't control at that time.
For sure.
So that was really tough,
Thank you for sharing.
for sure.
How many years have you been practicing now?
So I'll be going into my 4th year of practice.
Okay. And what does a typical workday in your life look like?
So typically, I work in an outpatient setting, like I mentioned before. So I work in a clinic. I usually start seeing patients around 10 a.m. depending on the day. It can end anywhere from 3 to 5 p.m. I usually see about 40 patients per day. Once a week, I do an after hours clinic where I work until 8 p.m. And then I do work about 2 Saturdays in a month, depending on my schedule and when I have time.
Okay. Awesome. What are the 3 most common conditions that you manage in your practice?
So we do manage a lot of arthritis, do manage a lot of diabetes, hyperlipidemia.
All right. So on average, how many hours do you work per week?
So I try to work between 30 to 40 hours per week, but sometimes it can be more than that with all of the administrative tasks, with all of the paperwork, with all of the inbox, prescription refills, and all of that.
So how do you maintain a work-life balance?
Well, I try to set boundaries for myself. Um, you know, Unfortunately, most days of the week I do have to put in a few hours after work, going through my inbox, but try to limit myself as to how many hours per day I'm doing that. If I'm able to during the week, I do try to carve out some administrative time during the week to deal with paperwork and all of that. Um, but that's how I do it.
Okay, so what keeps you going or what do you still love about medicine?
I think with medicine, nothing is ever the same. No two people will present with the same condition in the same way. I think it's constantly changing, and it keeps things interesting. And I do, you know, love teaching patients, about their conditions and, why certain things are happening with them if I'm able to explain that, and how, people can manage their own conditions and what they can do, aside of, taking medication and things like that in terms of lifestyle changes that they can make. And that's, one of the reasons that I love family medicine, because prevention is a big part.
That's great. Love to hear that. What myths or misconceptions do people have about your specialty?
Yeah, I think some people think that, as family doctors that, we don't work as hard as, maybe some other subspecialists. I definitely think that family doctors are some of the most hardest working doctors out there in terms of the amount of conditions that we're able to see and manage and handle and diagnose, on top of all of the other tasks that we're responsible for in terms of, coordinating care for all of our patients, for doing all of their paperwork and managing their prescription refills and all of that.
Okay, do you believe your compensation reflects the work that you put in?
Uh, Honestly, I don't. I think that, family doctors, I think we are well compensated, if you count how much we're being paid for the amount of patients that we see. However, I do think that there's a lot of work that we do behind the scenes that goes uncompensated. So like
Okay.
I spoke about before, sometimes, you know, certain paperwork, the time that it takes to go through an inbox, all the prescription refills that we do. Some family doctors, they are trying to, find other ways to get compensated for those things, but sometimes that can be a little bit unfair to patients, so I try to avoid that. But I do think that in Canada, at least the government, or Ontario, the government should have programs in place, or come up with programs to help compensate family doctors better, because there is a shortage and we need more. And I think
Right.
that's one
so
reason
true.
that people don't go into family medicine is because of those uncompensated work that we do.
Okay, that's amazing. That's great insight. So if you could go back in time and actually redo things, would you change your specialty?
I don't think that I would, just because I do love what I do. I love the relationships that I'm forming with my patients. I love that I can see a whole family at once. I love that I'm able to take care of kids as well as older adults. And yeah, so I don't think that I would. I really enjoy the flexibility that I have with my schedule, in terms of how many hours a day I work, if I need to take a random day off. The flexibility is amazing when it comes to that.
Okay. So now one of the most used terms in the medical community these days is burnout.
Yeah.
So how do you manage burnout?
Yeah, burnout is real. I definitely felt burnt out after residency, and then after my first 2 years of practice. Um, how I manage that now is, again, by trying to do my best to set boundaries, by taking time to enjoy things, that I enjoy doing, like spending time with family, going on vacation, exercising, trying to take time for myself. I think in taking breaks, I think that's the best way.
Okay. So lastly, for our 21st question, what's your message to the next generation of doctors who may be watching this?
I think my message to the next generation of doctors would be, I do think that medicine is a great field, and I think that, it does have a lot to offer. I think some people are kind of turned away when they think about how much time it'll take to become a doctor, and I definitely think that it's worth it if someone is passionate about medicine and helping patients.
Wow, thank you, Dr. Sadyora, for some great insight today.
Of course.
I really appreciate you being here and sharing your journey with us.
It's my pleasure.
I'm sure that this information will help pre-meds or current medical students like myself help navigate their own journey
For sure.
in medicine.
Yeah.
So I appreciate you being here. Thank you so much.
Of course. Thanks for having me.